Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Propofol. Propofol is available as 1% or 2%. Propofol is a milky white solution prepared in soya bean. Propofol is painful because of this soya bean preparation. There is one more type of preparation which is water based preparation called as propofol. Propofol contains egg lecithin, and this propofol which contains egg lecithin can have bacterial contamination. Mechanism of action of propofol through GABA at high it acts through GABA receptors. At high doses, propofol acts through NMDA receptors. Pharmacokinetics. Onset. Onset of action of propofol is in 15 seconds, and the effect of propofol is for 5 to 8 minutes because of rapid redistribution. Half-life of propofol is 2 to 3 hours. Propofol has no active metabolite, so there is no resedation. In the propofol, one-third of propofol is metabolized in the kidney and 20% is metabolized in the lungs. So this metabolism in the kidney and the lungs is extrahepatic metabolism. Systemic effects of propofol include the following. Systemic effects of propofol on respiration. Propofol will cause more profound and prolonged apnea. Propofol causes bronchodilator. So propofol will cause maximum inhibition of airway reflexes. On cardiovascular system, propofol will cause more profound hypotension. On central nervous system, there is decreased cerebral metabolic rate, that is around 20 to 30%, and there is decreased intracranial tension. Cerebral protection is not advocated with propofol because propofol can result in neuroapoptosis sometimes. Propofol is both anticonvulsant and it is both an epileptogenic also based on the circumstances and dosage. On GIT, it is an antiemetic. So, it is more antiemetic than ondansetron also. It is antipruritic. Propofol is antipruritic, so it can be used in biliary cholestasis or opioid induced pruritus. Propofol is agent of choice in induction. Propofol is agent of choice in daycare surgeries because of shorter half-life. It is an antiemetic and it has no active metabolite. Propofol is agent of choice or IV anesthetic of choice for asthmatics. Disadvantage of propofol. Propofol can be oil based, so it can be painful. Bacterial contamination can be seen with propofol. If there is bacterial contamination with propofol, you will have to discard it in 6 hours. Apnea and hypotension can occur due to propofol. This apnea and hypotension due to propofol are more common than due to thiopentone sodium. Addiction potential can occur due to propofol. This addiction potential due to propofol is due to increased dopamine. Propofol infusion syndrome. Propofol infusion syndrome occurs after 48 hours of injection of propofol. So summary. Propofol. Propofol is available as 1% or 2% solution. It is a milky white solution. It is prepared in soybean oil, so it is painful. We have Propofol, which is a water-based propofol, and it contains egg lecithin, which is responsible for bacterial contamination. Mechanism of action of propofol is by using GABA receptors. At high doses, it uses NMDA receptors. Pharmacokinetics. The onset of action is around 15 seconds. The effect is 5 to 8 minutes, or it can cause rapid redistribution. Then half-life of the propofol is 2 to 3 hours. There is no active metabolite. Half one third of the cases it undergoes hepatic metabolism, whereas 20% of cases it undergoes lung metabolism. So as a result, it has extra hepatic metabolism. Then systemic effects include in the respiration, it causes apnea and bronchodilation is also seen, and it causes maximum inhibition of airway reflexes. On cardiovascular system, it decreases the blood pressure. On central nervous system, it decreases the cerebral metabolic requirement of oxygen by 20 to 30%, and it decreases the intracranial tension. Neuroptosis is also seen. It is an anticonvulsant and epileptogenic. On GIT, it is an antiemetic more common than the ondansetron. It is antipruritic, thus used in biliary cholestasis and opioid-induced pruritus. It is an intravenous agent of choice for induction and maintenance daycare surgeries. Antiemetic, it is used as an antiemetic. It is used as agent of choice for daycare surgeries because it has shorter half life. It is antiemetic and also it has no active metabolite. It can be used in asthmatics also. Disadvantages are propofol is an oil based preparation, so it is painful. It can cause bacterial contamination so easily, so we should discard the prepared solution within 6 hours. Apnea and hypotension are seen more commonly with propofol than thiopentone sodium. Propofol infusion syndrome is one of the important complications.
Thank you and thank you for watching.